Hi, my name is Cole Williams. I am the EMS Clinical Coordinator for FVCC's Paramedic Program. Threw together a quick field preceptor training for those of you that are coming up on your 2-year preceptor refresher, or you're working for a new agency that has agreed to host some of our paramedic students. So getting into it, going to go over just a general program overview of what the students have done so far, go over the roles, responsibilities, and expectations of a field preceptor. Talk about some basic policies and procedures, team lead requirements, how many they need, what is a team lead, and then documentation of both what to expect from the students and what to expect from the preceptors. For those of you who have done precepting in the past, we used to use FizzApp. We have moved over to Platinum Planner. And there's quite a few changes with that. So I'll also kind of go into how to access your preceptor accounts and what to do once you get in there. So our program, it is a condensed 1-year paramedic program. We are an Associates of Applied Science for those who choose to pursue their prerequisites. So once they're in the program, the first 2 semesters, they're going to be in the classroom, lab, and clinical settings simultaneously, depending on where they are in any given week. Classroom setting, we're obviously going over lecture material from our various classes. In the lab, we're going over intervention practice, assessment practice, high fidelity mannequin work. So, I mean, amidst like the clinical setting and the lab and class setting, they should have about 900 hours of total learning experience. So when they arrive to your agency, they should be pretty comfortable with their scope as a paramedic student. Should be fairly comfortable talking to patients, comfortable with their interventions. That being said, not all of our students are currently associated with a field agency, and some of them may have varying levels of field experience. So, some of our students are going to come into your agency pretty high speed. They have previous pre-hospital experience and they're comfortable, and where, others, this may be one of their first times in a fire EMS station, and, they might need a little time to settle in and get expectations worked out. So once they do hit the field setting, they're required to complete a minimum of 360 hours with your field agencies. And during that time, it's going to be broken into 3 phases, which I'll go over here on a different slide. But they'll be expected to get team lead contacts, team member contacts. By the end of the program, they'll need at least 20 competency team leads, with a total of 50 patient contacts, 20 of those being team leads. And we'll get into that a little bit more here in a second. When they arrive to your agency, they'll have a current and active AHA, BLS, CPR, ACLS card, PALS card, and a PHCLS certification. We do take them through AMLS in the summer, but that will be kind of simultaneous to field ride time. I would say by the time they hit their capstone, they'll definitely have AMLS, but they're not going to show up for their first shifts with it. Okay, now getting into, I guess, what it means to log a team lead for a student. This used to be pretty simple. Now that we've adopted Platinum and some of the new things that have come out from our accrediting body with student minimum competencies, team leads have been broken into 2 groups. One of those is a formative team lead, and one of those is a competency team lead. Competency team leads are the ones we really care about, and that's what they're going to be accomplishing with their capstone phase, which I'll get into in a second. The formative team leads is more patient care oriented. They're going to be assessing the patient, asking the patient interview questioning. They're going to be formulating a treatment plan, maybe performing some interventions, and maybe starting to dabble into like the greater bird's eye view of team management and delegation. But the formative side is more attributed to just direct patient care. Also with the formative, you'll see at the bottom here, it says minimum to no prompting needed by the preceptor. That formative side is going to allow for a little bit more grace on, assistance from a preceptor, maybe some helpful questioning, some interjection, kind of somewhat steer them along the right path. Okay. Now, as we get over into the competency side, that's more global. They're taking essentially ownership of the entire call. They're being evaluated as an entry-level paramedic, and they're going to do, they're going to be in charge of everything still from the formative side with assessments and treatment formulation, but it's going to be more of that team approach to them, delegating their interventions, communicating with the crew what they're thinking. They're going to be giving radio reports to the hospital, nurse or emergency physician handoffs, just more of that entirety of the call itself. If you have any questions with that, I know it's kind of foggy, so if you have any questions, you can give me a call and we can kind of clear that up. This is mostly a review of what we already talked about, but successful team leaders, they're going to assign team roles, they're going to perform or direct the performance of the initial assessment on the patient. They're going to determine their field impression, direct or delegate team members, and then document their electronic patient care information through Platinum Planner. And I will say this because it has come up before. The field provider's ePCR and the student's simulated PCR on Platinum Planner are going to be very separate. We've had a couple instances of preceptors who have asked students to essentially complete their ePCR, whether that's through emergency reporting or image trend, and that can't be a thing. Those have to be very separate. That field provider will complete their documentation for the field agency, and the student will complete theirs on kind of the simulated Platinum Planner side. Okay, so now our field time phases, they're broken out into 3 phases. Phase 1 is kind of what we call our field experience, and that's that first 84 hours of ride time. And this is kind of what I said about, some varying levels of comfort in the field. This is kind of to get everyone on an even playing field, know what to expect from the agencies, kind of brushing up on some field patient interview stuff, and just getting them more comfortable and oriented to ambulances and jump kits and monitors and stuff like that. During that phase 1, they're mostly going to be logging team member. So they're not really going to be, doing team leads. I hope that they're going to be obviously doing some patient questioning, involving themselves with interventions, but it's going to be more that team member approach. They're going to have to be pretty high speed to log team leads. And I'm not going to say they never will. There might be some folks that just hit the ground running, but for the most part, it's going to be team member on phase 1. Now, phase 2 is kind of the bridge between that field experience and their final capstone. During phase 2, it's going to be 132 hours, and their charting could be a blend of team lead, team member, formative, competency. It'll just be kind of dependent on how they're progressing into that role as an entry-level paramedic, and kind of their comfort and experience going through that phase 1. So phase 2 is going to kind of be very student dependent. It's where we're going to be monitoring them for their progress to see where they're at. Now phase 3, That's their final capstone. It is comprised of 144 hours. And this is essentially, this is the phase where we're going to assess them as a entry-level paramedic. They're going to be in charge for all phases of the call, that delegation, and they're pretty much just going to be charting competency team leads. And the caveat to that would be, high acuity calls. I work in the field as well, and when we have students, if we get some calls that are high acuity, low frequency, pediatric arrests, pediatric traumas, some stuff like that. It's usually going to be the field crew running that, and that's not a slight to the paramedic student, but I think that's pretty well across the board of what's going to happen. The students accept that. So in those scenarios, they're probably going to be logging team member. But the other thing to mention with these phases, depending on where these students are at, some of them are traveling to other states across the country, so that might change a little bit for them. But for our local students, phase 1 and phase 2 is going to kind of be an even blend with various area fire and EMS agencies. Phase 3 is always going to be dedicated to an individual agency that student sticks to for the entirety of that 144 hours, just to keep consistency with the precepting, and so they kind of those preceptors know how that student's progressing or where they're at. So paramedic scope of practice, again, this is going to vary kind of where they're going and where they're at. But the bottom line is that a paramedic student can do anything their direct preceptor can do under their direct supervision. So that's going to encompass both state and or local EMS county protocols, whatever that agency is running under. The field preceptor is a EMS provider functioning at or above the level of the student. Now, this second bullet here, EMT students can be precepted by a licensed EMT, AEMT, or paramedic. And paramedic students may only act in an ALS capacity when precepted by a licensed paramedic preceptor. That being said, I don't expect these students to arrive to your agencies with the expectation that we're just going to sandbag field medics. I think most agencies are running one medic and one basic on an ambulance. That may be a little different in some places. But, on a BLS call that's truly BLS, that EMT can absolutely hop in the back, assume patient care. That student can be in back being precepted by the EMT, but it goes back to whoever is directly supervising that student. That is the height of their scope of practice. So if a paramedic student is in the back with an endorsed EMT, that paramedic student's scope of practice as a student is capped at that endorsed EMT's level, if that makes sense. It is ideal, obviously, to have our paramedics students precepted by a paramedic, but I get that that's not, always going to happen. It's going to kind of incur some burnout on some of our paramedic preceptors. And this is just what I was saying just there. I think I got a little ahead of myself. Yeah, essentially just paramedic students are not allowed to act beyond the scope of their direct preceptor. Skills of the field preceptor, first and foremost, is going to be good communication, just communicating to the student things that they might be doing well, things that they need improvement on, and being able to kind of put yourself out there to talk about some things that, might be uncomfortable but are going to benefit them, as a provider and a student. Also establishing a climate conducive to learning. And this could mean a lot of things, but I think it's important to convey to the students that everyone, that is currently a paramedic or an EMT has sat in their very seat. We've all been students. We know what it's like. and just kind of fostering that environment of, this is the time to make mistakes. You have a safety blanket, with a preceptor. So just kind of reemphasizing that and making them a little bit more comfortable. That next bullet, being willing to share knowledge and practical tips. You all know that, textbook knowledge only goes so far in this profession. A lot of it is on the job training and little things that, we pick up over the course of working in the field. So being able to share, some helpful tidbits of information that might be helpful to them in their, new EMS careers is huge. Next bullet, remaining patient and staying calm. And I would emphasize that's both as a preceptor and a provider. Set a good example of what they are striving to be as a paramedic, keeping a level head and staying patient with patients and with students as well. Being able to provide positive and corrective feedback, again, that just goes back to good communication, but having a purposeful eye on them to see what they can do to improve their skill set. Being a good listener, and that really goes back to having a sense of trust in the student and being able to take a step back as a provider to kind of hand off that hand off the reins to them as a student, and kind of just taking that step back and listening to their treatment progression and assessments and stuff like that. Stimulates critical thinking skills. That's probably going more towards AARs, and after a call is over, kind of breaking it down with the student, seeing what could have been done better, what they could have improved upon, so on. Promoting teamwork, that's pretty self-explanatory. I think everyone in this profession has a pretty good sense of that, so I'm not going to beat that to death. But roles of the field preceptor: being a competent clinician, a role model, being a teacher, evaluator, mentor, and a student advocate. I think those are pretty self-explanatory. We don't have to dive into them. Responsibilities of your job as a field preceptor, especially when they get there for the first day or two, having you or someone on your crew take the time to familiarize the student with the building layout. Where's the kitchen? Where is the bathroom? Where can they study? Where's the crew going to be throughout the course of the day? Obviously showing them throughout the back of the ambulance where the different gears laid out, different compartments within the ambulance, what kind of monitor you're running. For the most part, I think they're going to be most familiar with LifePack interface. So if you're running a Zoll or a Philips or something, maybe taking a little bit of time just refreshing with them the functionality of those monitors. Your ambulance jump kits is going to be really important for them as well. And then just going over maybe some medical protocols, medication dosing for whatever protocol that you're running under, that sort of stuff. And a lot of that can be done on a daily basis, especially with rig checks and whatnot. But getting that one quality one out of the way on their first day is pretty important. Obviously, oversight is a huge responsibility of a field preceptor. We need to be allowing students to perform those skills in the field and patiently encourage students and assisting where needed. Maybe throwing in, a couple questions here and there to kind of steer them along as needed, but, giving them the patience to kind of come to it on their own terms. And also being prepared to intervene. Doesn't happen often, thankfully, but, they are students, and there are occasions where they just go down completely the wrong treatment pathway. So being able to step in and kind of prevent things from happening is also pretty important. Additional responsibilities of the field preceptor: evaluation of the students is going to be super important. And this is speaking more to formal evaluation, actually logging onto Platinum Planner and documenting, what you saw throughout the course of the day, and going through those evaluation checkpoints. Lastly, for reporting, if anything does happen that's completely out of left field, the student's disrespectful, dismissive, lazy, poor bedside manner, disrespectful, any of that, please report it directly to me. If you can't get a hold of me, I'll also give you the contact for our program director. We've made it very, very clear to the students that they are guests in your guys' agencies. And if there is ever a problem with any of these students, I have let them all know that you guys absolutely reserve the right to remove them from your agency. And that's even before taking it through me. They're guests. If there's an issue and they need to be dismissed, they need to leave for the day, and then we can all, sort it out after the fact. But if there's an issue, please let me know. Throughout the course of the day, student downtime, they should be helping you guys with chores or station duties, kind of integrating with the crews. When that's not happening, they should be improving their skills with self-study, flashcards. If you guys give them the ability, looking through the drug bags and getting familiar with that. Going over case studies or scenarios. If you guys, want to run through some stuff, that's awesome. Run through calls that you guys have run that you've found interesting in the past. It's super helpful to them. They shouldn't be sleeping. They shouldn't be on social media, on their phone all day, and they know that. So, they should be purposeful with their time. Some policies and procedures. The attendance policy, it is, we are very fortunate for the time that's allotted to us from our field agencies, and students know that, it is a competitive schedule. They should be avoiding absences at all costs, but there are obviously instances that come up in their personal or professional lives where they might have to miss a shift. As long as myself and the field agency gets adequate notice, it'll count as an excused absence. Unexcused absences are the no call, no shows. Oh, I forgot my shift. Oh, I skipped my shift. And that's a 3-step disciplinary action. One's a verbal, kind of a freebie. Second one, they're going to get a written counsel and either a probation or a suspension from their field time. And if it happens for a third time, it's a 3 strikes you're out. They're either, going to be dismissed or terminated from the program. We usually never get there with that 3-step, but it is there in case it does happen. Aside from the stuff that we've already mentioned, if the student is involved in any sort of significant, call, if it's their first code for whatever reason, first field code, or anything that's particularly bothersome, pediatric codes, rough multi-system traumas. You guys are pretty good judges of that. Really anything that you guys are concerned are going to bother the student, and we're not necessarily going to pull that student from clinical rotation, but it puts it on our radar to kind of monitor the student and follow up with them just to make sure that they're handling it well. Also contact us if they have any exposure to a bloodborne pathogen, dirty needle stick, blood in the eyes, open wounds. I already talked about student conduct issues. And also just if you have any questions about the information we've gone over, if there's anything that I personally missed, go ahead and reach out. Here is both my information at the top and my program director, Ryan Pitts. For anything field rotations, I should be the first contact there. And Ryan should be used as a secondary. So I appreciate you guys sitting through this. I will have a secondary video going into Platinum Planner and kind of how to use your Preceptor logins, but that kind of wraps this up. So I appreciate it. Thanks for taking the time to host our students, and look forward to working with you guys.